Good morning, everyone, and thank you for joining me today. We're going to explore a complex and important topic, the multifaceted impact of drug use in society. We'll take a closer look at how drugs are defined, the various patterns of usage, and the emerging challenges faced by different populations. It's a subject that touches on health, social issues, and public policy, and I'm excited to share insights that will help deepen our understanding. Let's dive in. When we talk about the impact of drugs on society, it's important to understand that their influence reaches far beyond just the individual user. Drugs affect public health by increasing disease rates and worsening health outcomes, and they also raise concerns about public safety, economic stability, and social welfare. The consequences don't stop with the person using drugs. Families and communities feel the ripple effects, and healthcare systems face significant strain. Today, this issue is particularly urgent because we're seeing more drugs becoming available, new types emerging, and more complex health problems developing as a result. Having a well-informed perspective is essential. It helps us create better policies, prevention efforts, and treatment options. Ultimately, the effects of drugs are wide-ranging and multifaceted, so addressing these challenges requires coordinated, comprehensive approaches across different sectors of society. Here, we start by defining some essential terms. First, a drug is any substance that, when introduced into the body, causes changes in physical or mental states. This can include everything from medications to recreational substances. Next, drug use refers to the various patterns and behaviors associated with consuming these substances. This can range from trying something once or twice, which we call experimental use, to more regular, habitual use. Finally, drug dependence is a more serious condition. It describes a state where a person becomes addicted, displaying compulsive drug-seeking behaviors, and experiences withdrawal symptoms, both physical and psychological, when not using the drug. Understanding these definitions is crucial as we explore the broader topics ahead. Drug toxicity is a major challenge in healthcare, placing a significant burden on emergency services. Every year, countless hospital visits are connected to adverse drug reactions and overdoses, highlighting just how widespread this issue is. At the same time, we're seeing an alarming rise in drug-related deaths, driven largely by more potent synthetic drugs and the dangerous practice of using multiple substances simultaneously. This makes it absolutely critical to closely monitor these trends. By doing so, we can better understand the risks to public health and develop targeted interventions that can save lives. When we look at drug use among secondary school students, recent data shows that a significant number of them have either experimented with or regularly use various substances. The prevalence can differ depending on the type of drug, which is important to note. Several key risk factors contribute to this behavior. Peer influence plays a huge role, as teenagers often feel pressured to fit in. The family environment is also critical. Issues at home can increase vulnerability. Additionally, mental health challenges can make students more susceptible to drug use. Understanding these behavior patterns is essential because it allows us to design more effective prevention strategies that address the specific needs and influences during these crucial developmental years. When we look at drug use among college-age students, we see that it tends to be higher compared to younger students still in secondary school. This is particularly true for certain substances, highlighting a persistent prevalence in this age group. One of the key reasons for this increase is the shift in their social environment. As young adults enter college, they experience more independence and new social settings, which can lead to changes in how and why they use drugs. These shifts mean we need to approach education and support differently for this group, creating programs that address their unique experiences and challenges. Tailoring our efforts to their specific needs is essential for effective prevention and intervention. The rise of the internet has created a new pathway for obtaining illicit drugs, moving beyond the usual physical channels we're familiar with. This shift brings significant challenges, especially because transactions can be conducted anonymously, making it much harder to trace buyers and sellers. Additionally, new psychoactive substances can spread quickly online, complicating efforts to keep up. All of this makes it increasingly difficult for law enforcement agencies and public health officials to effectively monitor and control drug distribution in this digital landscape.